Welcome, everyone. My name is Carly Clemens, and I'm a Senior Policy Associate at Children Now, leading our environmental health work. Thank you so much for joining us today for the very first installment of our Bite-size Enviro Health Lunch and Learn series of webinars. This webinar is being recorded and the slides will be shared. We will circulate dates for the next webinars in the series shortly. Those events will be focused on PFAS or forever chemicals and on preventing lead poisoning. Our goal for this series is to give you information and actions to take matters into your own hands and better protect the health of your families and communities. Today, we will cover how drinking water standards are established, the benefits of tap water over bottled water, what a consumer confidence report is, and how to access it. Our expert speakers today are Andria Ventura and Evelyn Wendel. Andria is the Legislative and Policy Director for Clean Water Action in California and heads the organization's Toxics program. She has worked for 29 years preventing water pollution by stopping the use of hazardous chemicals and ensuring that we have the most protective drinking water regulations possible. She'll be talking today about how California regulates tap water and how to gain information about your own water. Evelyn Wendel founded WeTap.org in 2008 to improve appreciation, access, and use of public drinking fountains as a means to reduce dependence on single-use plastic waste, to improve public health and well-being, and to help eliminate the economic and environmental disparities caused by mistrusting public drinking water. WeTap developed the first technology globally to map and access drinking fountains and filling stations. She founded Tap Water Day in California as well. Evelyn will be speaking today about the scourge of single-use plastics on our environment. We will leave time at the end for questions, so as we go through the program, please do enter your questions in the Q&A feature, and we'll get to questions at the end. And now I'll hand it to Andria for an overview of how drinking water standards are established.
Thank you, Carly, and welcome everyone. Clean Water Action is very happy to be the co-host to this webinar series with Children Now. Just by way of introduction, Clean Water Action and Clean Water Fund are sister organizations. We were founded to protect the country's waterways and ensure that all people have a safe environment in which to thrive. Clean Water Action is our advocacy arm. Clean Water Fund is our outreach and education arm, but they consist of the same people and the same commitments. So we're very excited to be here today to talk about your drinking water. Next slide, please. One of the things that people sometimes get a little confused about or don't necessarily really know about is how their tap water is regulated. And sometimes that breeds a lot of uncertainty or distrust, but it is actually quite a robust regulatory process. And I'm going to start with the Safe Drinking Water Act. The Safe Drinking Water Act was established in 1974, and this is the primary federal law that ensures the quality of the country's public drinking water supply. It empowers the U.S. EPA to set enforceable health-based standards regarding contaminants in water. Now, very important to note, I mentioned public water supplies. The Safe Drinking Water Act regulates water coming from public water systems, whether they are municipal or private companies. These are systems that are providing water to your home, to local businesses, school, to a community. Okay. The Safe Drinking Water Act does not regulate private wells. There are no regulations for private wells on personal property, and it does not regulate bottled water. Next slide. Now, I mentioned that the law gives the U.S. EPA the primary responsibility of regulating contaminants in drinking water, but they're not the only ones that can do that. States, territories, and even some tribes can set drinking water standards as well. And California is very, very active in that role. California sets drinking water standards fairly regularly. Right now, the state regulates around 107 contaminants in water, which is pretty extensive. They do so under two circumstances. One is if there is a problem in California water that has emerged and is a threat to public health, the state can regulate that contaminant if there is no federal regulation. However, even when EPA sets a regulation for a given contaminant, California goes through its own regulatory process. It's very public, and it sets its own standard. It can set that standard as at the same level as the federal standard, or it can be more health protective. It cannot be weaker. And the reason it does that is that California has an agreement with the US EPA to enforce drinking water standards within the state. So if your water system is out of compliance with the law, it is the state that would step in to make sure that your water is protected. And they do that, they create this regulatory process through two agencies. One is the Office of Environmental Health Hazard Assessment, more commonly known as WEHA. They're scientists. They look at the health data related to a contaminant, and then the state water board takes that information and sets a legal standard. Next slide. So I'm talking about contaminants and standards. What do I mean by that? So there's a lot of things. There's no such thing as pure water. And so there are all sorts of things that can get into drinking water supplies and affect your health. Things like microorganisms that are, they come from nature, various types of chemicals and radioactive materials that can be both natural, from the environment or the result of human activities, but they're high enough in water supplies that they're deemed a threat to health. Now, the formal name for a drinking water standard is a maximum contaminant level, or MCL. And this is pretty straightforward. That term is exactly what the drinking water standard is. It is the highest level of a particular regulated contaminant that is allowed to be in your water and still considered health protective. Next slide. So, how do we set these MCLs, or drinking water standards? And frankly, the process at the state and the federal level are very similar, though they can come up with different results. And sometimes the terminology is a little different. But the first thing we need to do is establish what is the level of a contaminant that would not be expected, the highest level of a contaminant that would not be expected to cause a significant health risk to a community drinking that water over a lifetime. And that includes vulnerable populations, including children, elderly people, pregnant women, and so forth. So the first thing we need to do is, what is the best level of that contaminant to be health protective? However, um, sometimes there are technical or economic barriers to setting the standard at that truly health protective level. Sometimes we don't have the technology yet to see down far enough and detect the contaminant in your water. Sometimes we can't. The treatment may be so expensive and so onerous that people wouldn't be able to afford water. So we have to take in that technical and economic balance, put that into the regulatory process. However, California law states that a drinking water standard, or MCL, has to be at the public health goal or as close to it as is technically and economically feasible. And that turns out to give us, in most cases, a pretty good result, a pretty health protective standard for most contaminants. However, there is wiggle room here. And I can assure you that during regulatory processes, which take over a year, sometimes 2 years, they are very public. The public, and that includes organizations like Clean Water Action or other environmental and health groups. It also includes people like yourselves who drink water. The public can provide input and put pressure on our water regulators, because you know that polluters are doing that. Polluters have a voice in this. Water systems have a voice in this. And certainly polluters don't want to be held responsible for stringent drinking water standards when they've caused the pollution. And so the reason I mention this is the public input in this process is extremely, extremely important. We need people's voices to tell our regulators we need the optimum standards for our water. Next slide. And these are examples of where that kind of public pressure worked. Perchlorate is most famously known as solid rocket fuel, is widespread in California. 1,2,3 TCP or trichloropropane is a contaminant in a pesticide. And the most famous, Chrome 6, or also called hexavalent chromium, that is the famous Erin Brockovich chemical, is also very prevalent in California. And California, because of public pressure to regulate these in water, did so even though the federal government did not. So you can see that that public pressure can work. So what's coming up down the pipe? What's next for regulations in tap water? Next slide, please. The most important chemical coming down, or group of chemicals coming down the pike at the State Water Board, are PFAS. Now, PFAS, I'm not going to spend a lot of time on PFAS because they are going to be covered in our next webinar, and we certainly hope that people will join us for that. They are a huge class of chemicals, totally man-made. They are associated with very serious health impacts, and they're ubiquitous, both in our bodies and sadly in our water sources. Water sources impacting 25 million Californians have some level of PFAS in them. The most prevalent are what we call legacy PFAS, PFAS that are no longer used. They are called PFOS. Don't need to know what that stands for. It's a big, long chemical name. But PFOS and PFOA. PFOA is most famously associated with Teflon. Next slide. Now, the good news is that there is regulation for these chemicals. The federal government has established drinking water standards for both PFOA and PFOS, and it is a very healthy and very protective drinking water standard. It's for both of these chemicals, we're talking 4 parts per trillion. That is a very, very tiny amount that would be allowed to reach your tap. So we're fairly confident that what the state board, remember, they can't do anything less protective. We know that what the state board will come up with will be health protective in terms of the standard. However, while many systems in this state have already been proactive in addressing PFAS, my own water system, for instance, did take a contaminated water source offline for the time being. Many others are investing or have put in treatment. Some haven't. And the original drinking water standard that the federal government came up with must be complied by 2029. However, the federal government is looking to extend that time period. And we do not believe that's necessary. We believe that drinking water agencies can meet this standard. They're already doing it, so they certainly can do it by 2029. And that's what we're going to be fighting for later this year when the Water Board comes out with their standard and their plan for compliance. Next slide. So we're hoping that you will all want to get a little bit more involved, and it's going to be an easy way to get involved from the comfort of your own home. We're asking you to go to this site, and we will send it to you after this webinar is over. So if you don't get to write it down real quickly, we'll make sure you have it. But we're hoping that folks will sign up at this site to take some actions that both myself and our next speaker will be offering. In this case, we're simply trying to build a contact list of people who are willing to receive action alerts, maybe sign on to letters to the water board, or make a quick phone call to the water board telling them that we want strong and expedited PFAS drinking water limits. And with that, the last slide, please. I will thank you for your attention. I hope that if you have any questions, that you've written them down or put them in the chat. And I'm going to now turn it over to my colleague, Evelyn Wendel from WeTap.
Thank you. That was such an excellent presentation. I'm going to share that widely with teachers and students and my network, and I hope everybody attending today and who sees this will do the same. Very important information. Thank you so much. My name is Evelyn Wendell, and next slide. I founded WeTap.org about 20 years ago when my children were young and they started drinking from drinking fountains at school, and yet we saw a lot of plastic on the schoolyard and when we went to sporting events. And so I'm essentially just a mom who tried to do some good in the world and started this NGO to help find a solution and improve public drinking fountains and the narrative for public drinking water because we, as a society, do not trust our public drinking water, and we need to because we're very fortunate to have the all the protections behind our municipal public drinking water that's supplied throughout communities and in our homes. Yes, there's a lack of trust, and that's a big issue. Next slide, please. So the United States has one of the safest public water supplies in the world, the Center for Disease Control and Prevention. I think that's a pretty uh, solid statement, and the previous presenter explained why we can trust that. So we need to, keep moving forward and increase the trust in our public drinking water supply. Next slide, please. And I think I'm speaking to the choir. I think people understand and know that the bottled water industry is a almost $50 billion a year profits annually just in the US. I mean, isn't that astonishing? And the billions they spend marketing their product, which is essentially tap water in a single-use plastic container, is crazy. And the public drinking water that we get at homes and in our communities and at our schools is regulated by the US EPA, and the bottled water industry is really barely regulated by the Food and Drug Administration. Essentially, it was a product put on the market before we even analyzed what damage the packaging can do to the water inside. I mean, essentially, when you open a lid of plastic water bottle, hundreds of thousands of microplastic particles fall into the microplastic and nanoplastic particles fall into the bottle, Coke, any kind of plastic container. So when you're drinking from plastic, you're drinking the chemicals and the product, the container product. And we don't need to do that. We have excellent water from fountains, from our faucets, and we have to encourage our children and our communities to get back to the tap. Next slide, please. Science is important. This is a relatively recent study published in the New England Journal of Medicine that correlates micro and nanoplastic particles to cardiovascular disease. That's pretty heavy. Cardiovascular disease is caused by ingestion of too much micro and nanoplastic particles. So essentially, what we choose to drink our water from affects our health, and we can do better than that. Next slide, please. So I wanted to talk a little bit today about Captain Charles Moore. He changed my life. He wrote this book in 2019, Plastic Ocean. This information that he gathered and studied really had not been seen before. He's a sailor. He went out to, next slide, please. He went out to the ocean on his boats and saw that there was plastic in the middle of the ocean. Like, why is plastic in the middle of the ocean? So he went back methodically and trolled the water, collected samples, and analyzed what was in the ocean in the gyres around the world. Next slide, please. And you can see these are samples of that he took from gyres in the South Atlantic gyre, the Indian Ocean gyre, the South Pacific gyre. Why is plastic in the middle of the ocean? I mean, it comes from the use that we have on land. So not only is plastic affecting our bodies, but the ocean. And we live off fish from the ocean. Fish eat the plastic and it becomes part of our ecosystem. Next slide, please. He studied the intestines and what was inside of fish, and you can see that. Look at the stomach of an albatross, and it's just horrifying to see that these poor animals, fish, are eating the plastic that are swimming in the ocean now. We can do better than that. Next slide, please. Look at that. The Big Island, Balboa Creek in LA. That's in Nigeria and India, Somalia. I mean, it's all over the world. I think I'm speaking to the choir. I think you all realize this, but these images really affected me, and it made me change my behavior. Next slide, please. And I'm not sure if all of you have ever seen that snapping turtle. It's kind of a famous image in this movement. I mean that's pretty horrifying. And look at the intestines of that whale that they found, with sweatpants and golf balls and 20 plastic bags. This is an animal swimming in the middle of the ocean. It's horrifying. Next slide, please. And this, so you can see that the Mediterranean Sea is landlocked, and all the plastic that gets, tossed out accidentally or intentionally into the ocean is kept in the ocean. Look at that image of plastic water bottles 3,000 feet below sea level. We became a disposable society, and now the ocean and our bodies are paying for it. Next slide, please. And this one really is a tough one to see. Endocrine disruptors from plastic in our. So again, the water we get from our tap in communities is tested more stringently than bottled water. So this is a reason to trust the tap and use our public water and fight for keeping its integrity intact. Next slide, please. So I founded WeTap as a solution-based nonprofit. We started a WeTap app that maps public drinking fountains globally, and it is a GPS communication tool, very user-friendly. You can map fountains that haven't been added. If you're riding a bike, you can find your local drinking fountain. Next slide, please. We founded Tap Water Day in Los Angeles, and it became a state resolution a few years ago. This is in front of the LADWP, the Los Angeles Department of Water and Power, with city council members and the GM of LADWP and the head of facilities at LA Unified, where they improved their 45,000 public drinking fountains and keeps them at safe levels. Lead levels below the national and state standards. Next slide, please. I've started working with the Metropolitan Water District agencies. They provide water to half of California, and we're sharing Drink Tap Water Day information. Next slide, please. Some of our creative materials that we've developed to get the word out that our public drinking water supply is safe and dependable, reliable, 24/7. Next slide, please. We developed a teacher's toolkit about how to communicate about drinking water. You can find this online on the WeTap website or on the Metropolitan Water District website. And it communicates about drinking water. It gives little games and information to preschoolers up to high schoolers. Next slide, please. And we were included in the sustainability plan for the city of LA, which led to the hydration station program in LA, which is still ongoing. We got 200 new drinking fountains in LA. Now we're working towards 2028 for 2028 when the Olympics comes along. LA now has the World Cup, as you all know, and there's tons of temporary units, and we keep pushing for more permanent units as a legacy project for Los Angeles. Next slide, please. I also chair the Safe to Drink work group for the State Water Boards and Monitoring Council. So you can find information about public drinking water on the state website. If you type in, "Is my water safe to drink in California?" This is the top hit that you get. Next slide, please. And to wrap up, I hope all of you download and use the WeTap app to find fountains and add fountains that are not in our network already, or and also tell your administrators, park managers, city leaders to make sure fountains are maintained and available. If there's an area that you do not see a fountain and you think there should be one, bring it to their attention. If I can help you in any way, you can reach out to me at wetap.org. Follow us on Instagram. That's a direct link to us. Check out our website. Every decision you make, every choice you make matters. It affects your health. It affects the health of communities around you, of ocean health, of posterity for the future. It's been a pleasure talking to you today. Let us know if we can help you in any way, and you'll find ways to get involved. Thank you for your time.
Okay. We're going to wrap up the presentation part today with how you can learn more about your water coming into your community, into your home. Because you don't have to believe myself or Evelyn, you can look this stuff up yourself. And so I'm going to talk about something called consumer confidence reports. Next slide, please. So what is a consumer confidence report? Basically, it's a water quality report. It's often called that, in fact, and it's your right to know document about your water. Again, I'm talking about water coming from a public water system. So you're obviously not going to get a report from a bottle you bought of water, and or if you have a private well, that is under your own responsibility. But your public water system must publish once a year, no later than July, a report that provides you with information about regulated contaminants that were found in your water during the year before. So when you get your water confidence report in 2026, it's telling you what was in your water and what was the quality of your water in 2025. Next slide. So what are the types of information that entails? Well, first of all, there's fairly general information. It tells you where your water comes from. My water comes from a particular groundwater source. Others in my community have a different source, but it tells you exactly where your particular water is coming from. Sometimes it's more than one source. It gives you definitions of the terms in the report. You know, you've already learned what an MCL or a maximum contaminant level is, or public health goal is. It'll help you read the report. There'll be general information on types of contamination, like that slide I showed you earlier that lists microorganisms or different kinds of chemicals. And it'll also provide warnings for particularly vulnerable populations who may have issues, particularly with microorganisms. For instance, people with impaired immune systems, so they can be extra aware. Next slide. But the core of what your consumer confidence report would tell you is it's usually in the form of a table, and it tells you what were the detections of regulated contaminants that were found. It'll tell you the level of that contamination. It'll even give you a range because it can change from day to day. It'll give you information about the general health effects of those chemicals or micro organisms or whatever it is. It'll give you some general information on typical sources of that contaminant. That may not be the actual source of why something got into the water system where you live, but it'll kind of tell you whether it is usually a naturally occurring contaminant or whether it's from an industrial process, something like that. And then finally, it'll tell you what the public health goal and the MCL is for the contaminant that was found and if that system is in violation. And I have to tell you something. I have reviewed hundreds and hundreds of these reports over the years, including my own. And I very rarely in California see a violation. They exist, and I have seen them. But what's good about that is that water systems tend, first of all, you have the right to know about that. But more importantly, too, water systems will tell you why something happened, why they were not, why they were in violation, and what they are or have done about it to protect you. A violation does not mean you're going to get sick, but you have the right to know whether your water system is acting appropriately. But they, frankly, are very, very rare because water systems put in a lot of effort to try to provide safe, clean water for you. Next slide. Now, this is an old example of a typical chart. And it's not only old, it's from another state, so the terminology is a little bit different. They're using federal terminology, but it was the clearest one I could find. To give you, they don't all look as pretty and clean as this, but it's basically the same information. So just let's look at the antimony, just to give you a sense. That first column where it says MCLG, that's the federal term for PHG. Okay, yours is going to say public health goal. Okay, and in this case, it's 6 parts per billion. At that level, we would not expect to see health impacts in your community. And then the drinking water standard, the actually MCL, is also at 6. Well, the good news is, in this particular case, there was no antimony found in the water. It was a non-detect. Okay. Same thing for the range here. They sampled it in 2008, and there was no violation. If you look above it at chloramines, they did find some of that. This is a disinfectant material, but it was extremely low, and people were within that safe limit. So they're giving you really good information here, and in fact, this water is highly drinkable. Next slide. Now, what other information may appear in your CCR? It should report on what we call secondary contaminants. So contaminants that affect your health are called primary contaminants. That's what we regulate. That's what's legally enforceable. But sometimes there are contaminants in water that won't affect your health, but they're unpleasant. They're aesthetically problematic. They may cause an odor. They may cause some discoloration, which could impact doing laundry, could stain your clothes or not clean your clothes, or make them look as bright that it'll clean. But it's not as high quality. Won't affect your health if you drink it or cook with it. Now, do not make make a mistake. Water systems must address secondary contaminants, and that's why we want them to report it, but they're not a health threat. However, sometimes there are contaminants that are emerging as something like an interest. This happened years ago with PFAS, which I mentioned. Around 2019, there was a realization that California probably had PFAS. And so sometimes the water boards will require water systems to start testing for chemicals to see if they're a problem. They're not regulated yet. They may not even be a problem. We don't know. Okay. We started that testing for PFAS in 2019. Water systems generally do not have to report that, with the exception of PFAS, because of a state law that was passed. But they do not have to tell you if they have found unregulated contaminants in the water, but many times they do. And that's not a red flag for you not to drink the water. What that's telling you is that they're really transparent about what they're doing and they're being really responsible. Next slide. So who receives the CCR? Well, automatically in the mail, the person that receives it is the person that pays a water bill. So for instance, if you live in a home and you write a check every month or do it through an app, but you pay your water provider, whoever it is, you send in the money, you should get the water quality report in the mail. They don't always look as slick as this one, though. This is a real example. Sometimes they're just black and white. They vary. Sometimes they're tucked in with your bill. Sometimes they come separately, but keep an eye on it. It has to come sometime between January and July, remember. Okay. But everyone has the right to a consumer confidence report. That is really important. Next slide. So if you don't get it automatically, you should try to get it to access it. So who wouldn't get it? Renters don't get it if the landlord pays the water bill. That's the situation where I live. I live in an apartment complex in San Jose, and I don't pay that bill directly. Okay. Sometimes condo residents or mobile home park residents pay their water bill directly. They may get it, but sometimes the report goes to the residents association or some sort. So that may be the case there, or something like an in-law unit dwellers may not get it automatically, but you have the right to the information. So how do you get it? Next slide. If it doesn't come to you in the mail, or if you didn't notice it came in the mail and you threw it in the recycling bin, this is how you can get it. Well, first of all, if you rent, you can ask your landlord for it. However, what I have found that's just easier, frankly, is I go to my water provider's website. And most of the time, or many of the times, you just find it there. You can look up either, 2026 water quality report or 2026 consumer confidence report, and you can find it there. If you don't know your water provider, your landlord would know, or your neighbors will know. Okay. In my case, it's San Jose Water Company. You can call that water provider and ask for a copy to be mailed to you. And you should, if you speak another language or read another language or know someone that does, you should pass this on. If a significant number of people within the community that a water system serves speaks another language, they should be making that material available in that language. This is a good example. This is a water system that you have one in English and one in Spanish in this case. Now, obviously, not every language that people speak in California is going to be covered by that, but it's good enough information that if you know someone that speaks another language or reads another language and it's not available, it's important information, and encourage them to find someone to translate it for them. Next slide. Now, these are not very difficult to read, and I hope I gave you some good background about what to look for in your report. However, if you are trying to figure it out and it just doesn't make sense to you, if you Google how to read my water quality report, there's a lot of great information out there. The US EPA has information, our state water board has information, Centers for Disease Control, many health organizations and children's organizations have the information about what the water report is telling you. However, we want to make that really easy for you. So if you have questions, please feel free to go to our website. This is the California Clean Water website, and you hit the contact button and a message, send an email with your contact information, and either myself or our state director will get back to you, and we'll make a plan to get online and walk through that report with you. Last slide. Or if you really want to make it easy, this is my email, and you can feel comfortable just emailing me saying, hey, I live in such and such a place, and I'd like to go through my report with you, and I'm happy to help you with that. And with that, I will close it, and I think we are ready to wrap up and then go to questions. So I'll turn it back to you, Carly.
Thank you so much, and thank you both for those really excellent presentations. I just learned a lot. Um, and I don't see, well, actually, before I do that, apologies. As we noted, we have the website to take action. So please do visit that website when you get those materials after the webinar. And I don't see any questions. If you have questions, please enter them and we'll give you all a few minutes. But I have a question in the meantime while other people warm up their question asking, if that's okay. And this is a question for Evelyn. And I know, obviously, we've learned today, and we all know that reusable water bottles that we refill from our taps or from water fountains are better than disposable plastic bottles for so many reasons. But within reusable bottles, are there safer alternatives that you would recommend? Like I know some people use Nalgene's, which are still plastic, and there's metal and there's glass. So I'm curious your thoughts on that.
That's a great question. I actually stainless steel and glass. That's basically the only thing I drink from. First of all, they're easy to wash, keep clean. You can put them in your dishwasher, but um, plastic will leach. I just don't really trust the plastic containers. So, and our pots and pans are stainless. They can be heated, they can, be cooled down, and it doesn't really affect what's inside it. So glass is best. Stainless is great for for traveling, and I would invest in them for your children. It's worth it. Buy like five of them. Just expect they're gonna maybe lose them once in a while, and that's fine. You're still saving thousands of dollars. You're still protecting their health and well-being. You can write their name on the side with a little Sharpie pen, and we gave away 5,000 canteens uh, high school sometimes, and they would make a corner where they put all the canteens with the kids' names on it. So it worked for a while. So that's kind of a good thing if you want to do it on the big scale in schools and parks and stuff. So thank you for that question.
Of course, that's great. And just to say as well, I know the reusable tumblers, like the big Stanley cups, have gotten so popular lately, and most of those are stainless steel, but they come with plastic straws. And I think so many people don't realize that that is something you can replace as well. So I would imagine replacing those plastic straws with metal or stainless is an easy swap to minimize plastic exposure, even in your reusables.
And they can be really inexpensive. I just bought a whole packet of metal straws at Marshall's. Not doing a shout out for a store, but it they were inexpensive. Even Walgreens sells the metal straws, and they come with a little brush, so you can even clean them out. But they're easy. You just rinse them out.
And also when you go to a restaurant and they want to give you plastic, I always say, do you have a reusable cup that I can use for my water? I mean, I think a lot of times we need to kind of change the norm by asking the right questions and requesting the right products. So what we do really does affect the future. I mean, every little decision matters. A lot of restaurants are getting used to it and they're putting stainless steel or glass or reusable, buy water so that we can get it ourselves. But sometimes people want to give me an water in plastic. I'm sorry, I don't drink from plastic.
Can
I
I
just
add something to that?
Yeah.
I think that is a wonderful comment to make. Clean Water Action and Clean Water Fund have a program called Rethink Disposable, where we actually work with restaurants. But one of the things that kind of drives me crazy, and I think is useful for other people to think about, it is actually California law not to automatically give you a straw with a drink, whether it's in it's a soft drink in a restaurant or a cocktail in a bar. That is actually California law. But not everybody knows that. Not everybody does it. Sometimes waiters just automatically throw the straw on the table. And what I have found that has been useful is sometimes just politely, when you're walking out the door, telling the manager of the restaurant, I'm not trying to cause you any problems, but that is, those are the rules, and that matters to me, makes a big difference. And they're not offended. In my experience, they're not offended. But, there's a couple of times when I've walked out the door and I've seen somebody in authority and say, you might want to tell the bartender not to do that. If a person asks for one, they can give it. But we're trying to educate people not to ask for them. But that is a hint. Um,
I didn't know that. So, yet another thing I've learned from this webinar. I don't see any other Q&A rolling in from the audience, so I just want to encourage people, if you have any questions, definitely feel free to enter those into the Q&A, and I'm sure I can confidently say that if you have questions for Andrea or Evelyn that arrive after the fact, they will be happy to answer those for you, and you'll have their contact through that landing page.
Most
Um,
definitely.
and there is that link in the chat as well. Thank you so much for that. I'll pause just to see if either of you have any closing remarks you want to leave the group with before I close this out, because I know we have a little time left.
Evelyn, do you want have anything to say
I'm
first?
I was very happy to see your presentations. I think this is it just should be common knowledge, and we can't hear this enough. We can't repeat this enough. So I encourage everybody who sees this to share it with your friends who are parents, teachers, administrators, principals, park directors, city leadership. I mean, this is just good, solid common sense that just needs to be normal and basic information. So thank you for including me in today's um, activities. Sincerely.
Absolutely. Thank you for being here. I'll just end by saying, water is life. We know that. We admit that there are cases where people don't have safe drinking water. We all know about Flint, Michigan, for instance. And in those cases, there are emergency situations that have to be dealt with. We fight to make sure all people do, both Evelyn and I, have access to clean water. But we do want people to understand where your water comes from, how it's dealt with, it's regulated with, and your voice will matter in continuing to help us ensure that we all have safe drinking water because most of us do. And so with that, we hope you'll get involved and at least let us, have your contact information to call on you when we need you. And we thank you for being here. Please share this information. We'll put it on YouTube. And if you ever need speakers for anything, I'm sure we can wrangle this group to speak to these issues for you.
Anytime.
Well,
Thank
thank
you.
you all so much for your time, and thank you so much to Andrea and Evelyn for these really excellent presentations. We hope that you learned a lot today. I know I did. And we really hope to see you at our upcoming webinars, which will take place later this summer. And those will be on PFAS and on preventing lead poisoning. And please stay tuned for more details about those events that will be forthcoming shortly. Take care, everyone. Thanks so much.
Bye bye.
Bye.